A record 59,400 new coronavirus cases have been reported in the United States on Wednesday, July 8, 2020. The total number of deaths has surpassed 132,000. There is a resurgence of COVID-19 in at least 33 states. New Zealand, South Korea, Vietnam, China, Canada, and countries of the European Union have all been able to bend the curve and bring down the number of COVID-19 cases. In spite of an influx of Malayalis from overseas and from other states in India, Kerala has been able to contain the spread of coronavirus and limit the number of people who died of the disease to just 27 so far. These places employed a combination of measures including lockdown, isolation, testing and contact tracing, phased reopening of businesses, and created containment zones when new hotspots popped up. The United States lacks a national strategy on how to contain the pandemic. In the absence of adequate contact tracing, a vaccine for prevention, and effective therapeutics for treatment, social distancing and wearing a face mask are the only proven means to prevent the spread of the pandemic. The charts on the left are from June 26, 2020. Florida had only 5,004 cases on that day. 11,458 new cases were reported on July 5th. The average age for those testing positive for COVID-19 in the state is 21. In Texas, a stay-at-home order was issued on April 2nd. It was lifted on April 20th. It took 4 months to reach 100,000 cases in Texas. In 2 weeks, that number has doubled to 200,000. Hospitals have reached near full capacity in many cities. Governor Abbott has reversed himself and mandated wearing face coverings in public. Arizona, California, South Carolina, North Carolina, and Georgia are some of the other states where there is a resurgence of COVID-19. When stay-at-home orders were lifted, young people packed beaches, worked out in gyms, and partied in bars and restaurants. Most of them did not wear face masks or followed social distancing guidelines. As the number of new cases increases, hospitalization and deaths also increase. Healthcare professionals are overwhelmed and PPEs are in short supply. There is going to be a repetition of what New York, New Jersey, and other states experienced in the months of March and April. The northern states locked down early, stayed the course, and followed a phased reopening. They report far fewer new cases. In the US, we do not have a national or even a statewide policy to contain the resurgence of COVID-19. Some states, cities, and counties have made face coverings mandatory. However, in the absence of enforcement, people tend to ignore the guidelines. Infected persons need not be symptomatic. Asymptomatic persons, most of them young, are super spreaders. A face covering protects you from inhaling droplets from others and other persons from your droplets. Wear a mask and carry a spare when you go out. There is evidence that coronavirus is airborne and accumulates over time indoors. People in a crowded restaurant or another indoor place can transmit the virus through exhaled air. Donning a mask will help. Wash hands frequently with soap and water. Stay home if you can. Travel only if necessary. Avoiding any size gatherings, including church services, is the most prudent thing you can do under these circumstances. We need to ask these questions to ourselves. Is it necessary to organize a birthday party or a first Holy Communion party? If invited, should we attend such a party with our children and elderly relatives? If you decide to attend, then wear a mask and practice social distancing. Wearing a mask should be treated as a public health matter that can save lives, and not as a Republican or a Democratic issue. Remember, we are all in this together, yet we are still on our own. Here are two cases of young people who became COVID-19 patients. One of them is Carson Lee Davis. She was an immunocompromised 17-year-old from Fort Myers, Florida, who contracted the disease while attending a huge church party. Her parents gave her hydroxychloroquine and azithromycin, drugs that Trump promoted. She died on June 23rd. Her parents said she was a devout Christian and a follower of Jesus. Jim Flores is a 30-year-old Scottsdale, Arizona man who went to a crowded bar. 2 days later, he had a fever of 103 degrees and body sores. He was admitted to the hospital and was put on breathing tubes. Listen to what he told Aaron Burnett of CNN in an interview.
The last thing on our mind, we were on the verge of reopening, and we didn't really care about COVID, to be honest with you. Me and my buddy went out to this North Scottsdale bar, and we went ahead and just had a good time, like what you would do at a bar, restaurant, club.
Among the young, the symptoms of COVID-19 are mild. Most of them recover. Long-term effects are still being studied. Irreversible lung damage, referred to as post-COVID fibrosis, is a condition seen among the young survivors. Even patients as young as 30, not hospitalized for the virus, have been linked to blood clotting and strokes. Listen to Dr. Anthony Fauci's advice to the young.
Is that if you get infected and spread the infection, even though you do not get sick, you are part of the process of the dynamics of an outbreak, and what you might be propagating inadvertently, perhaps innocently, is infecting someone who then infects someone who then is someone who's vulnerable. That could be your grandmother, your grandfather, your sick uncle, whom have you, who winds up dying. So it's a very difficult messaging when people say, I'm young, I'm healthy, who cares? You should care, not only for yourself, but for the impact that you might have on the dynamics of the outbreak.
Trump does not want to wear a face mask. That does not mean you should not wear one. Mr. President, please lead by example. Wear the damn mask. What do you have to lose?